Good day. So now we will be having a look at the humerus. So you can see here, this is the proximal end of the humerus, shaft, distal end of the humerus. Okay, firstly, let's concentrate on the proximal end of the humerus first. Okay, you can see here is the head of the humerus. Head of the humerus directed medially, and it articulates with the glenoid cavity of the scapula. Okay, distal to the head of humerus, here you can see there's a shallow groove encircling the head of humerus. This is the anatomical neck of the humerus. Encircling the head of humerus is the anatomical neck of humerus, and distal to the anatomical neck of humerus, you can see bony prominences, tubercles, the tubercles of the humerus. Here is the lesser tubercle of humerus, projecting anteriorly, located on the anterior surface, and laterally here you can see greater tubercle humerus projecting laterally. In between the tubercle of the humerus, here you can see a groove. This is the intertubercular groove of humerus. Okay, immediately distal to the tubercles of the humerus, there is a surgical neck of humerus. Okay, this is where fracture commonly occurs, surgical neck of humerus. Okay, distal to the neck of humerus, you will see the shaft of humerus. Okay, approximately on the middle of the shaft of the humerus, on the lateral side, there is a slight bony prominence here. This is deltoid tuberosity. Deltoid tuberosity, attachment of the deltoid muscle on the lateral side. Okay, and then let's have a look at the distally. Okay, distal end of the shaft, here you can see the distal end of the shaft here, it widens. It widens. It has sharp edges on the sides. Okay, this is lateral, so lateral supracondylar ridge on the medial supracondylar ridge, and these ridges end as a bony prominence. This is medial epicondyle, larger than the lateral epicondyle. At the distal end of the humerus, you can see here on the lateral side here, there's the capitulum, articular surface. Capitulum articulates with head of radius, and medial to that here is trochlea, articulate with trochlear notch of ulna. Superior to these articular surfaces, there are bony depression. Superior to the trochlea here, you'll find the coronoid fossa, and that receives coronoid process during flexion of forearm. Superior to the capitulum, there's the radial fossa that receives head of radius during flexion of forearm. Okay, now let's have a look at the posterior surface of humerus. We will have a look at the proximal end of the posterior surface of the humerus first. Okay, this is the head of humerus. Okay, and encircling the head of humerus here, shallow groove. This is anatomical neck of humerus, and distal to that here is the greater tubercle of humerus. On posterior surface, you will not see the lesser tubercle of the humerus. Okay, and distal to the tubercle, this is the surgical neck of humerus, and distal to that is the shaft of humerus. Okay, as I've mentioned just now, and around the middle of the shaft of the humerus, lateral side here, there's a bony prominence. That is the deltoid tuberosity. Deltoid tuberosity, where deltoid muscle attaches to. On the posterior surface of humerus here, near to the deltoid tuberosity, there's an oblique groove. I'm sorry, someone has highlighted the groove. And that groove, this oblique groove is called radial groove, in which crosses the radial nerve and deep artery of arm. Okay, as we go down at the distal end of the humerus, here you can see the lateral supracondylar ridge, medial supracondylar ridge, medial epicondyle, lateral epicondyle, and inferiorly here at the distal end you will see the trochlea. Superior to the trochlea there is a bony depression, and this is the olecranon fossa, which receives the olecranon of the ulna. Okay, thank you. That's all for humerus.